written questions. And so if you saw the folks out front, you can pick up a piece of paper from them and write out a question. We get far enough for you to have a question. Otherwise, they'll be in the aisles as we go along here. We got a play practice coming in right after us, so I'm guessing we probably won't get to all your questions tonight. So if we don't, I think there was a spot for your email on the sign-up sheet. We will try to get back to you if you have a written question if we're not able to answer it here tonight. We do have people going through them, try and consolidate them in case there's duplicate questions. I think we're ready. Are you ready? Get the thumbs up. All right. My name's Tim Hunt. A lot of you know me. I've worked in journalism around here for 25, 30 years. Worked briefly in Congressman Kine's office. Back to journalism. VernonReporter.com. If you've been there. There's a donate button on there, by the way. So we'll get going here. So you're probably wondering, who the heck is Kickapoo Conversations? Never heard of those guys. It's a very loose-knit group, but it's quite a group. So we meet once a month at Borgen's, usually for breakfast, sometimes other places. And we were officially under Wisconsin Partners. And my understanding is Wisconsin Partners kind of started in this area. Michelle Eng would have the story behind that, if you want to talk to her. And Rachel Heller is our leader from Wisconsin Partners. She's around here somewhere. You'll see her floating around. So we get together. There's no agenda, which is nice. Whatever's on our mind. And we took up housing at one point. You guys tackled, I think, daycare. A bunch of different things. We had Wisconsin Partners Board out here. We did a tour through the watersheds. So anyway, we tackled various things. A really incredible, talented group of people that are just fortunate that I get to sit and talk with them. The bad part is when you have 5 conversations going on at a table at Bergen's, you only get to hear one of those conversations. So really good group. And we were sitting around recently and we started talking about, boy, there's a lot of changes happening. There's some shifts going on here and they're pretty major. So tonight, the idea we came up with was, well, you know, I'm not sure everybody knows what federal dollars do in their community. And having worked briefly in that sector, I know there's a lot of money that hits the ground out here that nobody ever realizes, you know, what that is or where it came from. So we got really smart people that will talk more specifics about their particular sector. They have a lot more knowledge of these things than I do. I've got, you know, a fair amount of general knowledge, but they've got specific areas they have to deal with every day. So that's how we came up with the idea. And it's really great to see as many people here that care about these issues. Let's see, what else was I going to talk about? So really what we wanted to do was, so there's 3 things that I would kind of shoot for. These guys haven't completely read through all this, but really what we'd like you to take away tonight is, first of all, this is about choices. So it really doesn't matter if we're talking about cuts or funding or whatever. Inevitably, we're going to have choices out of this changing environment. So the people on the ground that deal with this, what we want you to do is just hear from them and understand what those choices are about. You could say, well, that service isn't worth it. I don't think we should try and fill the gap and keep that service alive. We should let that go by the wayside. Or we should find money locally, or maybe Madison can help with that. But just laying out what that might look like and what these people do every day. Also, we thought, let's have a panel of people discuss this in a number of sectors, because the thing I think gets missed sometimes is that these things are all connected. So what happens with David at the hospital might affect what Hetty's doing at Cooley Cap, or vice versa. Or what's going on at school might affect what's happening with Trina at the library, what's happening in conservation. You know, they're all connected, so when you have an impact in one area, you're likely going to have an impact in a bunch of areas. There's going to be a ripple effect, either positive or negative, either way. So that's why we wanted you to hear from a bunch of people. The other thing is, we'd like you to just kind of ask as you listen to this, are these services or these things we're talking about, are these investments? In a lot of cases, I think they are investments, but you might not think so. So what I mean by that is you can put money in a certain area, and it ends up saving you money over here, or making it so you don't have to provide another service in a particular area. So are they investments, or are they a waste of money? So that's what they'd like you to take a look at. So I wanted to give you just one quick example. I'm going to take up all their time. We're going to try and have 3 to 5 minutes for these guys, which is a lot to ask of them. But we're trying to get through this stuff as quick as we can so we have a chance for questions. So I want to tell one quick story, though, because it kind of highlights what we're talking about, give you an idea of what we're trying to lay out here tonight. So the county had a domestic abuse program. That program was funded about 3 years ago. They went after a grant, a federal grant, Department of Justice. They asked for $150,000, they got $200,000, which, how many times does that happen? Getting more money than you ask for. Really smart people in the community, Sheriff's Department, social workers, human services, lots of people at the county level, an outside counseling agency, and they all banded together, applied for this grant, got the money. It did a bunch of things. It helped intervene. They trained people to intervene and go out in crisis situations. So that person in that situation had somebody to talk to. Maybe they didn't realize there were resources available. They trained sexual assault nurses. We had none in this county. They had 2 now in Hillsborough. They started men's groups. So they were providing services for the person who was the victim and also the abuser. And by April 22nd, they got a letter that said, stop doing what you're doing, we're not going to reimburse anymore. So that was an impact. So the county had lots of discussions, lots of committee meetings, and what they decided to do was, this is an investment. We want to save this program. So the county stepped up, used some ho-chunk funds. They got it funded through the end of the year. Now they got to work on what to do moving forward after that. But that's an example. So you're stepping in a situation where you're possibly stopping that abuse cycle, potentially for generations. So that's a really good example of not a huge investment, $200,000, probably a pretty big impact. And the county said, we want to keep that going. So you're probably going to hear different areas in all these different sectors where those choices are going to have to be made. So that's enough of me talking. First person we're going to have come up is Steve Michaels, right here from Westby Schools.
Well, thank you, everyone. And as you look around, this is not a thrift sale. We are having hosting the Faraway Community Theater's presentation of Mary Poppins. So we hope you come back. So welcome to the Performing Arts Center. Hope you come back. The show for Mary Poppins starts July 31st and runs through August 3rd. So there are 2 evening performances and 2 matinees. Hope you'll consider taking that in. But I appreciate you all being here to learn more about this important topic. And as I talk about, I'm going to try to give you a high-level understanding of school finance as it relates to this topic. So this is going to be a tough challenge. Bear with me here. So understanding how money comes into schools is incredibly, incredibly complex. And for each of Wisconsin's 421 school districts, the recipe is different. And it's based on property values, it's based on demographics, it's based on sparsity, it's based on enrollment. There's a whole bunch of factors that play into that. And frankly, it's kind of mysterious. So this number comes to us now, at that point, when the money leaves the schools, it's very easy to track. So at every regular board meeting, every check that's cut, every bill that's paid is acted on by that school board. So you can see the money leaving. The way it gets to us is a little bit confusing. All right, so that's part 1. Part 2 is understanding revenue limits. So they started in 1993. And revenue limits are the budget. That's the amount that schools are given to work with. And the formula that I think is the easiest way to describe is revenue limits minus state aid equals your local taxes. So revenue limits minus your state aid, so those districts that are aided very highly have a less of a local tax burden. And those that are aided at a lower level have a higher local tax burden. So once again, revenue limits minus state aid equals local taxes. All right, so then what makes up aid? So state aid, a big portion of that is revenue. It's a per pupil allotment. So the per pupil amount, the minimum, is $11,000 per student, and that is attached to enrollment. So that amount varies from district to district, and it varies based on where you were in 1993. So whatever, if you were a high spending district, you were locked in at that amount in 1993. That's how some disparity occurs throughout the state. Federal aid is another factor in this formula, and it basically, federal aid does a number of things for schools. It supports students with special needs, it supports struggling learners, food service, transportation, and then grant funding for projects like farm to school, COPS grants, things like that. So we talked about how different the formula is for each district. The impact of federal funds on each district is also very wide. So just within our area, this is a total percentage of federal funds related to the revenue limit. So here in the Westby area schools, federal funds make up 6% of our revenue limit. DeSoto, 8%. Viroqua, 9%. North Crawford, 13%. Kickapoo, 14%. Cashton, 16%. Brookwood, 17%. Hillsborough, 18%. Lafarge, 23%. So you can see that federal funds impact each district on a very different level. And it's all based on your demographics, your property values, all those types of things. All right, then to make things a little more interesting, in school districts, 70% or more of the budget is for personnel, people, and programs. And many of the items that are funded with federal money are required by law, like special education, like reading plans for kids who are struggling with reading. We're committed to this, and we're going to do the right thing for kids with special needs and the kids that are struggling readers, one way or the other. But with reduction in federal funds, it means that we have to take money from the general fund, and that's how a reduction in federal money impacts all kids in the district. So there's been talk this week about bipartisan pressure to release the hold on some of the title money. That you might have heard about this. And just for perspective, the hold on funds in the Westby area schools equates to about $81,000. And we are among the lowest federally aided districts in our region. So think about what that could mean for a district like Lafarge, where 23% is federally funded. Thanks for being here for this important topic, and on to our next presenter.
Next, David Hartberg with Vernon Health. Did I get that right? All right, multitasking, you got it, man. So, all right, well, if you haven't noticed, we're rebranding, so every opportunity I get to get Vernon Memorial and Vernon Health up there helps all the humans to be able to connect those things together. So thanks for the opportunity to come and talk to you tonight. Much like school funding, healthcare funding is equally complex, so given 5 minutes to do it, we're going to rapid fire this kind of stuff to you. Certainly many different ways in which federal funding impacts an organization like Vernon Health. You heard a lot during the passing of the big beautiful bill that healthcare was a major topic and a major focus, mainly with Medicaid funding and some of those kinds of things happening. So not unlike schools, different communities, different regions of healthcare have different amounts of Medicaid that an organization may serve. So Vernon Health has about 10 to 11% of its clinic and its hospital funding coming from patients that present with Medicaid funding. So it's not a significant portion. For many, many rural healthcare providers, that percentage is 15, 20, 25%, similarly in urban areas with that. So again, much like school districts, a varying amount of how that might impact those individuals. So we're certainly tracking, trying to understand when these things related to Medicaid go into effect, what they will look like when they get into effect. If you've got any clear understanding of that, I would welcome your information, because as I try to understand and our team does, it's still really, really confusing. We do rely upon grants that have certainly come from the federal government, both directly to us to help support different programs in our organization, but to entities that are like the Wisconsin Office of Rural Health. They help us both find grants, obtain those grants, do grant writing for us. They're also a key element of recruitment of nurses, physicians, and others. And so certainly some concerns that have their funding is cut as severely as it is. The Office of Rural Health will either be much less than what it once was or not even exist. And so they're kind of an offshoot for rural hospitals that again ends up getting us connected to many different ways. The BBB, I guess as I'll continue to call it, does have some interesting things in it that could be of an advantage related to telehealth. Certainly a continued discussion about how that may impact how people consume healthcare. We have many different models of telehealth that we try to provide for our patients. There hasn't been a huge uptick in this area in utilization of that, and actually most providers have not seen patients want to use that as much. So all apologies to those of you who have used it and like using it, but it hasn't had as huge of an uptick in that, but we'll continue to be in some of those spaces with things. There is also discussion about $50 billion in what's called a rural transformational grant. Similarly, don't really understand what that all means yet. Some of the early discussions are that the $50 billion, about 50% of that will be equitably distributed amongst the states. I don't know what that looks like. No one's really put math to paper or pencil to paper to understand that. 50 billion over 5 years sounds like a lot of money. It'll be poof and gone. And no idea how that's going to directly come to Wisconsin or to someone like Vernon Health. So you can get big stars in your eyes really quickly. We aren't doing that because we don't know what that's going to look like. About the other 50% of that funding, what we're hearing and understanding is that the states would have to apply for the other 50% of that through different projects that a state might do in totality or individual regions or entities might do in there. And so we're already talking with the Wisconsin Hospital Association, with DHS about what ideas they might have. Our understanding is that those grants would have to be applied for and approved by the end of the calendar year of 2025. So it starts to feel like that's really coming up quicker as summer kind of goes away from us. The last thing I guess I would talk about a little bit, because I think here in Wisconsin we heard more about it relative to the state budget. So there is a thing called a hospital tax that we at Vernon Health pay and other hospitals pay. It's been around for about 18 years since it was first enacted. And it's similar to school funding. It's a convoluted process, perfectly legal, but it's a way to draw down federal funds. So the hospitals pay a tax into the state. States send those money to the federal government. The federal government matches that amount, sends it back to the state. The state takes off what's called a skim off the top of that and says, we're going to use that for roads, for schools, for other things to try to help run a good state. And then we'll give the remaining money back to the hospitals. Vernon Health, for a while, was a loser in that proposition. We paid more taxes in than we got back. But we also knew that that helped to support other hospitals in urban areas or in rural areas worse off than we were. So it's kind of like we're trying to be a good neighbor and a good partner. And as we have patients that need not only services in our area, but in La Crosse or in Madison or Milwaukee, children's hospitals that have a high Medicaid population, it's the part that we can kind of do to be able to say, hey, we need you to help take care of our community. We're willing to kind of pay this tax and get it back. I don't think we really had a choice, but and then we did it nonetheless. Wisconsin as a state did not maximize that opportunity for that percentage of hospital tax. And so our state legislators on both sides of the aisle, Governor Evers Specifically, Tara Johnson and Brad Pfaff in this area helped to understand the opportunity Wisconsin had for a Wisconsin state tax to move it from 1.8% to 6%, the percentage a lot of other states were already at and have been at for a while, to draw down federal funds. Lots of discussion about people at the federal level liking that, don't liking that. It was an opportunity for Wisconsin to say, we weren't taking advantage of it, how can we take advantage of it to help support rural health care hospitals within the state? And so they were rushing to try to pass that. So at 1:30 in the morning on July 1st, that's why this thing is signed, because the BBB is going to be signed on July 4th, and Wisconsin would have been frozen out of the opportunity to change that afterwards. It's the quickest version I can give you of a very, very convoluted, exhausting process of lots of people's on phones and lots of people's trying to understand this and be able to do that. And so again, it helps to bring some benefits back to rural Wisconsin and other hospitals in the state relative to that entire process. So overall, again, concerned about what Medicaid decreases are going to mean for us and for others with that, but there's some other things in the bill that we're intrigued by. We'll see you a year from now, and we can tell you more about did it pan itself out in any positive way or in any hurtful ways in our community. So, thanks very much. Tara, did you hear me mention you as you walked in? Okay. I didn't know you were going to be here. Thank you again, Tara and Brad. You want to over there too? I literally didn't know you were going to be here, but now I'm a little embarrassed. But please thank those people on behalf of the local hospital. They did very, very well. Thank you.
All right, next up is Hetty Brown, Executive Director of Cooley Cap.
I get to represent Cooley Cap, and I also get to represent social service nonprofit organizations in the area. Although there are a wide array of nonprofit organizations serving our beautiful area. And nonprofit organizations provide those services in our community that government or for-profit organizations just simply don't have the resources or the capacity to provide. Nonprofit organizations literally fill gaps in our communities that other organizations can't provide. And a lot of nonprofit organizations rely on federal funding in order to provide those services, either directly by receiving federal grants or by receiving state grants that are mostly funded by federal government. And that's Cooley Cap's situation. Cooley Cap is your local community action agency, and 85% of our annual funding is sourced at the federal level. So that's our federal funding. And if you want to learn more, I have some annual reports out on the front table, and you can learn more about our funding, but 85% of that comes from the federal government. Cooley Cap has been serving the Cooley region, including Vernon, Monroe, Crawford, and La Crosse counties for nearly 60 years. And we serve or provide assistance to about 23,000 of our neighbors each and every year. You can see some of the programs that I have up here. These are all some of our largest programs at Cooley Cap that we offer. These are our core programs, and they are all federally funded. This includes our food programs, and yes, we operate food pantries, but we also administer the Federal Emergency Food Assistance Program that provides food commodities to food pantries across our region. So we help to make sure through that federal program that food pantry shelves across our region stay full of food. Our supportive housing programs, housing whether that's transitional or permanent housing, emergency housing programs, those are all federally funded. Cooley Cap houses or provides housing access to about 300 to 400 people in our region every single year through those programs. Home weatherization programs. This is probably one of our most well-known and popular programs. I see one of our lead auditors right there in the back today, so we can thank him for all of his work. Our home weatherization program, including our emergency furnace response program that makes sure people have heat in the middle of winter, those are federally funded programs. And through our county governments, the emergency energy assistance programs and crisis assistance programs, all federally funded programs. Then we have our affordable housing development. We are an affordable housing developer and have been for 30 years. That's federally funded programming, financial counseling and wellness services, home buyer down payment assistance. We have home repair programs, including well and septic services, and many, many, many programs. So we have about 20 different program areas, and like I said, the majority are federally funded. Now, Coulee Cap is not just a service provider, we're also an employer in this area. And each year, depending on the programs that we provide or the services that we're offering, we employ between 60 to 70 employees, and those are mainly full-time jobs. We offer competitive wages with benefits. So we're employing local community members as a local employer. But we are also helping to support the local economy. Because every dollar that we bring into this community from the federal government, we pass on to our local community through our payments to local businesses, through contracts, through local businesses. In 2024, we passed through about $10 million to almost 250 local businesses. Those were through payments that we made to plumbers and electricians, retailers, local grocers, landlords, title companies, utility cooperatives, supply companies, credit unions, car repair shops, and many, many more of our local businesses. So as we're having conversation tonight, I would ask you to think about your local nonprofits and not only think of them as service providers, but think of them as local employers and think of them as driving the local economy. And what would it look like if we weren't here? What would our small business economy look like? What would our local employment force look like? Thank you for your time and attention tonight.
Next up is the Director of the Library of the Year last year, Trina Erickson, McIntosh Memorial Library.
Only because Tim brought it up, I will say we were named the best library in the state of Wisconsin in 2022. The main source of federal funding for our nation's 125,000 libraries is called the Institute of Museum and Library Services. Library funding draws less than 0.3% of the annual federal budget, but it has enormous impacts in communities nationwide. From technology classes for job seekers to services for people with disabilities, from library delivery for older Americans to summer reading programs for families, which all libraries are going through right now, this federal funding makes a real concrete difference in the lives of Americans every day. I said there's 125,000 libraries in the United States, but let's break it down to Wisconsin. I'll never forget this. I was at a library conference in Wisconsin somewhere, and the speaker said there's 478 public libraries in Wisconsin, which is equivalent to the number of Quick Trips in Wisconsin. So I never forgot that. But today I went, and if Google is true, I knew the number of public libraries probably was about the same. The number of Quick Trips is 506, just so you're aware, in Wisconsin. We are very library rich in Vernon County. There's 8 public libraries in Vernon County, and if my memory is right, there's 5 Quick Trips. So we're well represented. But let's talk about what the Institute of Museum and Library Services funds, and this is how it impacts you. These are some key benefits. Expanding access to information and digital equity. What this means is enhances broadband access and digital literacy initiatives, ensuring all libraries serve as digital hubs for communities. And that that's really, really important. As library director, I see every day people coming into the Viroqua Library, and I'm sure this happens in Westby and all the other libraries, where they simply don't have access to the internet. They're choosing between food for their family or the internet, and they're going food first. And they come to the library because we provide that service to them at absolutely no charge. And if they don't have a computer, no problem at all. We provide that as well. And so this is part of what federal funding does, is enables us to provide access to technology and to the internet and to those invaluable resources for people, especially that are job seeking. We see this all the time where people that are re-entering the workforce after years are stunned that they cannot walk in with a paper resume and say, here, I want to apply for a job, because everything is moved online. And some of those people don't even have an email address. And so they come to the library and say, I need something called a Gmail account, and so that's part of our task, is to help them do that, to empower them to become a better citizen for themselves. Federal funding for us also empowers my staff and myself with professional development. It provides us with training and required continuing education opportunities, so we have a really strong staff, and when people come in, we can help them to the best of our ability. It strengthens community engagement and lifelong learning because it funds innovative programming that supports workforce development, small businesses, and those job seekers that I just talked about. Innovation and modernization of library services. It helps libraries adapt to changing community needs. I've been the library director in Viroqua for going on 18 years, and what I have seen in 18 years is unbelievable. And we need this support so we can stay on top of things that are trending in what I call library land. I remember a few years ago, or maybe a little bit longer, right around the holidays, so many people would come to the library with a tablet and put it on our checkout desk and say, my kids gave me this and I have no idea what to do with it. But they said, go to the library and you'll help us. And so we have to be trained to stay on top of what's happening in trends across the country. And it also pays for consultation and expertise provided by staff at the Department of Public Instruction in Madison. These folks continue to coordinate and lead and plan for improvements and provisions of our library services. And it's imperative that we have those leaders at the state level that can come out to my small community of Viroqua and say, this is what you can do in Viroqua to make a difference for all the patrons that come to you for assistance. So that sustained funding ensures that Wisconsin libraries remain vital community hubs. I can say, and I can't talk about the other 7 libraries in Vernon County, but federal funding has absolutely impacted the McIntosh Memorial Library in Viroqua. We personally have lost I wrote it down, $253,000 because of federal cuts. And that's a lot of money to make back for a real small library, folks. I always say, whoever said the word fun and fundraising is wrong. Fundraising is hard, and that is a lot of money for us to get back. But I'll just throw out one little website for you. If you want more information, it's mywisconsinlibrary.org, and you can see there more stories than what I've just presented to you about how impactful federal funding is for all libraries in Wisconsin. Thank you.
All right, we're going to have one more, and then we're going to shift. We're going to have a personnel change and have the next speakers come up and sit down. But Brad Robson, Brad's from Vernon County, but works in Monroe County at the conservation office over there. So we wanted Brad to talk about ag funding and conservation and those kind of things. And you're on so many boards, I can't think of them all. You're going to have to tell people how many boards you're on.
No, we won't go down that road. Yes, good evening, and I was really glad to see when they popped the slide up earlier that they listed me as Vernon County Cattlemen Association, because I'm going to throw a quick disclaimer out here. As Tim said, yes, I do work for local government. So what I say tonight, these are my words. I'm not representing any federal business or any county or state businesses. So I'm going to probably say something I shouldn't, but I want to have that disclaimer out there. Yeah, federal dollars and conservation. There's probably a lot of people that maybe don't put those together, but conservation world can really help a lot of the people sitting on this panel with us. You know, number one, if we can do a better job in our farming industry and have healthier people, we don't need to go to the hospital as much. If we can have a sustainable farming operation, we don't need to reach out for help as much. You know, we can support our school systems, we can stay rural, we can keep our people here. Those federal dollars coming back, a lot of people will look at them that aren't aware of how agriculture works and conservation works and think they're just simply payments back to farmers. They're really not. I'm here to tell you that those farmers are doing something to earn those dollars. Now, am I going to say there's no government waste? Absolutely not. We all know better than that. And that's why we're discussing this topic tonight. The federal dollars can really help, though, take a lot of pressure off our county and our state level governments to try and help fund projects that will benefit the whole communities. For an example, the office I work in, we're partnered with the federal funded side of the conservation. They had 65 applications sent in last year for funding. Normally they would have probably got 40 to 45 of those funded. Initially we got back 6 funded projects. I believe we're up to 12 now, so money is still somewhat trickling in. But these are good projects. They're building healthy soil, they're cutting down on soil erosion, they're cutting down on water runoff. And if we can protect our soil, protect our lands, get that water in the ground before it runs downstream, takes up roads, then our townships have to fix roads, then our counties have to fix our roads. It's just that those dollars really, they really mean a lot to the people that get them. And by cutting that kind of funding, I fear what's going to happen. The people receiving that funding are not making money on these projects. They're doing good things with the federal money. So I know I've had discussions, in the last 6 months with people, and they're just not going to do some of these good projects that need to be done. I would like to say, our state is stepping up some, and I think we really need to think about that in the future and talk to them about it. And I think that's probably where a lot of these dollars are going to come from eventually, is through the state route. And personally, I would just as soon pay my tax dollars to the state and have them give them back to me instead of going 2 or 3 steps up and then 2 or 3 steps back. So I would like to acknowledge the increase in funding for conservation from our state budget this year. They're helping funding more positions within the conservation world. So we can at least be out there and talking to people. And that allows us also to shift some of our local dollars and use them for some projects that we need to do. The food assistance dollars that come from federal dollars, they can tie into the conservation world. You may not think they do, but if we can have healthier soil, raise healthier foods, connect our local small farmers, maybe it's with our school districts, with our hospitals, with our churches, with our libraries, with our nonprofits, to grow healthy food, to get back into the diets that we need. And we don't need as much federal money then, in all of these cases. So, yes, it's a challenge. We're trying to figure out how to deal with it, just like everybody else. I do have some hope for the future that things will calm down here a little bit and cooler heads will prevail. But again, I would like to say the counties and the states, I think, are going to really have to figure out how to do this with collaboration from some of our great local nonprofits. Thank you.
Thank you, Brad. We're going to do a little switcheroo. We're going to bring up our last 4 speakers, I think, up and to have a seat. While they're doing that, I think you can tell why we wanted to do this. There's a huge disconnect, I think, between where federal dollars come from, where they go. I saw this in my work. The money comes from DC, goes to the states, it goes over here to this agency, and then over here to that nonprofit. Pretty soon you're not quite sure where that money came from. So good to lay it all out. Also, we are recording. We will try to post that recording somewhere. We'll get that out on social media, and maybe out through some emails, and let you know where you can watch that or refer people to. Christina and Mary are up and down the aisle, so if you want to hand them questions, feel free to do that. A few more speakers, and we'll get wrapped up, answer some questions. First, we're going to bring up Brandon Larson from Vernon County Emergency Management. It's kind of tough with the county stuff because we were thinking about having individual department heads with Health Department and Human Services, but Cassie's going to sum that up, and Brandon's going to talk about emergency management first. All right,
Thanks, Tim. Aside from being your local emergency manager, I'm also currently the vice president of the State Emergency Management Association. Emergency management is not just about reacting. We're planning ahead all the time, building partnerships, strengthening the resilience of our people, infrastructure and institutions, bringing together nonprofits, schools, emergency services, hospitals, local governments. We work across our boundaries. Disasters don't just stay within our county boundaries, as we've seen. So we're constantly working with our partners across the state. We, across the state and the U.S., receive what is called Emergency Management Performance Grant. That grant currently has not been awarded yet for 2025. About half of the state Wisconsin emergency management staff are funded by that grant. Every county in the state and tribe are also funded by that grant. So we're still waiting to hear on that, like many other federal grants for other departments. That helps do our outreach, do what we need to do with responding to and planning for disasters, whether it's flooding, hazardous materials incident, just planning ahead for those crises, having plans in place. Recently, the Building Resilient Infrastructure and Communities Grant was canceled. In the state, I've got a statistic here, about $50 million in impacts to the state of Wisconsin when that grant was canceled. There were $27 million in projects for storm shelters that are now in limbo. Our hazard mitigation plans, those are 5-year plans, those also run underneath that grant. There were counties that were a step away from starting that renewal of that plan and now are trying to figure out how they're going to pay to complete that renewal of that plan. Our plan was done in 2023, so we have a few years to wait and see what happens. Also, a lot of those that BRIC grant with mitigation funds, that's how we improve roads and culverts so they don't wash out again, or acquire homes with home buyout programs to get them out of the floodplain. A lot of that is BRIC program, which is for now canceled. There are state programs, but a lot of those dollars came from the federal government. Just a fact, in the first 14 days of July, across the U.S., there were over 1,700 flash flood and flood warnings issued. Some of them as local as Grant County here locally. And in that same time period, there were 15 flash flood emergencies. We're the ones that help deal with those alongside those municipalities and highway departments recover from those, both initially and long-term down the road. Because when events start local and end local. It starts here, and when we run out of capacity, we ask up to the state and the federal government. We're the last ones to leave. The nonprofits are the last ones to leave. So having that EMPG, or Emergency Management Performance Grant, is vital to all emergency managers across the state, across the U.S., and right now, along with other grants, we're not sure where that's at. So again, that just empowers what we do. So that's what I have tonight. Thank you.
Now we will have the administrative coordinator for Vernon County, Cassandra Hannon. She has the unbelievable challenge of trying to sum up all of this for the county.
Thank you. Yes. So I'm just going to focus on some of the bigger areas within the county that are affected by federal funding. When we talk about federal funding, it's easy to think that it's something that only happens, at the federal level or at the Capitol or something that you see on TV. But here in Vernon County, federal dollars are being utilized to provide a variety of programs and services to our residents. The county acts as an arm of the state, and the state really acts as an arm of the federal government. So those programs that are run, we're running programs for the state is running programs that are provided through federal funds. So these funds to people living here in Vernon County are personal. They show up in our kitchens, our clinics, our roads, and in our day-to-day lives. They help us care for our neighbors, support our children, and protect our most vulnerable residents. In 2024 alone, Vernon County received over $5.5 million in federal funding. These dollars supported everything from child welfare, public health and nutrition, and transportation. As far as Medicaid goes, it is our largest single source of federal support at more than $2.2 million. That funding helps ensure that low-income families, seniors, and individuals with disabilities have access to vital health care. With new federal policy shifts pushing for more frequent eligibility checks, that's going to pose even more challenges. About 2/3 of our county-owned nursing home residents are Medicaid supported. So that is a huge impact for those seniors living in that facility. Our SNAP and WIC programs help provide over $1 million in nutritional support, helping hundreds of families afford basic groceries. And while those work requirements are expanding, Vernon County is also seeing more need. Over 1,000 households applied for energy assistance. That's not 1,000 people, that's 1,000 households within the county. And then our EDRC provided over 3,500 meals this last month. And what we're seeing over the course of 2025 is that demand just keeps increasing. Vernon County is one of the highest poverty rates in the state. Our child welfare services, including foster care, our Birth to 3 program, and our children's long-term support program are lifelines. As of June, we had 34 children enrolled in the Birth to 3 program, 109 in the Children's Long-Term Support Program, and nearly 30 receiving specialized community option services. These aren't just numbers. They're children with developmental delays, disabilities, and trauma, children who rely on these federal programs to thrive. Beyond human services, we receive federal dollars for transportation funds, which help to repair our roads and provide safer travel for our residents. As Brandon noted, another $83,000 we received last year to support emergency management. We were talking about this earlier today. The county has more federally declared disasters than any other county in the state of Wisconsin, and more flooding events as well. But we're facing uncertainty going forward. As David alluded to, we don't even know what some of these requirements are going to mean for us yet. It is basically impossible to find information at this point, and it's incredibly frustrating as our county board looks to develop our budget for next year. We don't know what the impacts are going to be. We've had a 50% cut in vaccine support for underinsured children. Our county has one of the lowest vaccination rates in the state of Wisconsin, so that is incredibly discouraging. Our health department works really hard to try and keep that vaccination rate up, and we have just a lot of issues there. They're also had a 30% reduction in emergency preparedness funding, not something that the county wants to see cut. Federal funding is not guaranteed, and yet our residents still depend on us to deliver these services. The county does not have the funding to cover these programs when federal funding is cut, and neither does the state, though the state is making some efforts to try and help us in that, so we appreciate that. Really hard to explain county funding, but we're bound by strict levy limits that have been in place for a couple decades now. So we don't have that ability to tax our residents more to help pay for these services. So I thanked him for sharing the story earlier. That was a great opportunity that the county had to help provide those services, but it's not something that we would be able to regularly maintain. Closing these programs are not just budget lines, they're investments in the health, safety, and resiliency of our community. Thank you.
Thank you, Kelsey. Next up, we have the mayor of Westby, Danny Huggins. Danny is also the president of the Wisconsin Municipalities Association. So he has a lot of knowledge about how different communities are being impacted.
All right, thank you. Yes, top of being the mayor for City of Westby, which I'm very proud of. I am the current president of the League of Wisconsin Municipalities. The League of Wisconsin Municipalities is an association that represents about every city or village in the state. So I get to work with the mayors and village presidents statewide. This should be real easy. I can just say everything they said, because that affects your municipalities. A lot of times I'm dealing with, looks like state funding through state agencies, stuff like that. But you got to remember, a lot of that money will start federal and come down through state agencies. And probably contrary to popular belief, the cities and villages do not have unlimited money. I know this for a fact, doing the budget every year. To be totally honest with you, I think every village and city do their best to try to maintain with their budget. And it really comes down to, at the end of the day, the budget barely, and sometimes not even that, covers maintaining what you have. And that makes it difficult to grow and expand. And we all want to live in cities that are growing and prosper and a great place to raise a family and work and play. But municipal funding, like I said, it pretty much takes everything just to maintain what we have. So we want to grow. Economic development is a big part of it. We want our cities to grow and bring in jobs and improve life for everyone. That's where federal grants and stuff like that come in. We can't do it with our budgets. It's just not possible. We've got some great examples here. Westby and Faraway, both in the last few years, were able to put in new business parks. Yeah, we'd like them to fill up faster and all that. It takes time. You get kind of stuck in the whole situation where you bring a business in, they want to make sure there's housing for the people that work there, and then they don't want to build the housing until they know the jobs are there, so you kind of get stuck. But it's moving along. And there's no way without federal funding we could have put the business parks in. So without the business parks, we're not even in the game. We can't attract new businesses. All the infrastructure, we're talking millions of dollars. And it's just necessary for us to grow. We do the best we can with what we got, and like I said, both cities with the business park are prime examples of the economic development. There's also smaller things that happen in the city of Westby. We received ARPA funds. We were able to actually put together pretty much a real police station. Which before they were pretty much working out of a garage. That helps make things function for them and all that. Another small thing, but it wouldn't have happened without the federal funding. Everything, I was joking, but everything we listed today affects your community. So I knew I'd probably forget things or whatever, so I'm going to try to wrap it up with a little summary I put together here. Importance of federal grants and funding for municipalities. Federal grants and funding play a crucial role in supporting the operations and development of municipalities across the United States. These financial resources help local governments provide essential public services such as infrastructure, maintenance, public safety, transportation, education, housing, and environmental protection. Federal funding often supplements limited local revenue sources, enabling municipalities to undertake large-scale projects that would otherwise be unaffordable. Grants also promote innovation and equity by targeting funds toward underserved communities in priority areas like disaster recovery, economic development, and public health. By leveraging federal support, municipalities can improve quality of life, stimulate local economies, and ensure resilience in the face of socioeconomic and environmental challenges. Thank you.
And now I know why everybody looked at me funny. I got my speakers mixed up. But Kim Ward is next. Kim runs a guardianship service in Viroqua. So she helps out people who need guardianship help.
We're a guardianship agency. We serve basically the Seven Rivers region. Most of my people are in Vernon County, but we have people placed all over the state now. Because of what's already happened before these bills, or the big bad bill even came into being, which is what I call it. So I'm going to give you a couple of real life examples of what things that have happened to my people since just the beginning of the year. One man has been on disability since he turned 18. He's 58. Immediately after Trump was appointed or was inaugurated, we got a letter in the mail saying they were going to review his disability status. He went through rescheduling, scheduling, to get a doctor's appointment, psych evaluation, blood tests, all that stuff. This is a guy who didn't doctor much. He kind of worked his life as long as he could, but physical ailments and frailty got to him. He was no longer able to work. Went through all these tests. They denied coverage. Cut him off. He's lived on disability since he was, 4 years, since he was 18. We are appealing that right now. I don't know how long it will take. He luckily has a base to fall back on, but if he didn't, he'd be homeless, destitute. I don't know what we do with him, for him. A similar guy who's still going through the review process, started at the same time, been on disability all his life. He's going for a second psychological evaluation and assessment. He, though, does work right now still, so he would probably be considered able-bodied and able to work. My third example is just the immense amount of paperwork it takes to renew medical assistance for people, and I'm doing this for 80 people over the course of the year, 5 to 10 a month. Paperwork is getting worse, thank you, and more extreme, more detailed, more documentation required. One of my people lost Badger Care coverage because of some compliance requirements, didn't submit the paperwork on time or whatever, so her coverage expired. She fell ill about a month ago, went to the doctor, they suggested she stay over for more testing, she couldn't afford it, she went home, she passed away. Shocking. She leaves an adult child with disability besides. And that was just because she didn't meet the paperwork requirements. So this is already happening, and I don't even know what's going to happen when all this cuts and everything go into effect. The goal, I think part of it behind it is to make the paperwork so burdensome that people fall off. That's part of the way of cutting the money, is so cynical. It doesn't have anything to do with whether they qualify or not, they're not going to do the paperwork. They're shortening the time frame required to be able to submit paperwork. Shortening the time frame for backdating coverage from 90 days to 60 days. And in that whole 60 days, people are sick while trying to get their paperwork done so that they can be qualified and get some sort of health care. I'm doing that for my people, but I don't know how people out in the community are going to be able to do it. I've been doing it for 25 years, but it's unbelievable. what's going to happen to them. And this doesn't just affect Medicare. There's cuts to the ACA, which is the Affordable Care Act. What they've done there's subsidies in place for that insurance, but they left the subsidies in place but did not fund them. So that means the insurance benefits or the subsidies to pay for these high premiums is going to affect all the people in that program, which is me, one of these. I expect my insurance premiums to at least double, probably more than that. They don't know. So it's here, it's already a problem. This is going to make it worse. I think I can help my people, but I really am super worried about the rest of the community, and I don't know, and they're scared. My people are scared. Everybody else is. So this is something I'm glad. Thank you for everyone for being here. We need to pay attention to this because it's going to hit us all. It's just going to be staggering effects.
We've got one more speaker. I want to remind everybody, if you want to get questions in, we've got some questions already, but if you want to write down a question, they'll be up and down the aisles here. Our last presenter is Pastor Michelle Hagen, at Emmanuel Lutheran Church.
I want to stress at the very beginning, Emmanuel Lutheran Church does not receive federal funds, directly or indirectly. We may have people who have jobs and other areas that are impacted by federal funding cuts that would then have a trickle-down effect into the congregation. But our Emmanuel is largely funded by my congregation, who cares enough for others to do so. One of the reasons I'm here, there we go, we started a free little food pantry about 18 months ago. On average, we saw people using our free pantry about 2 to 4 times a week, and they took just what they probably needed between cycles of going to the food pantry. Since March, we are stocking and refilling this food pantry twice a day. So I was interested in why we are seeing such a drop. I talked to our local Viroqua food pantry, Living Faith Food Pantry. It's open 1 day a week till 7, which is a barrier for many people who work. So that would be part of the reason, I think, that our food pantry is being utilized more frequently. I also noted that they told us that they did receive 3 deliveries a month for TFAP, that's that Emergency Assistance Food Program that Hetty mentioned, that is now down to 1 time. And so they are not getting the fresh fruits, vegetables, milk, and other things that they relied on. And Community Hunger Solutions, which is another provider, provides a lot of poundage of milk. And they noted that from 2024, it's down from 2,869 pounds in May to 1,243 pounds in May. So the commodities cut to the USDA that impacted our farmers because they had food and milk that they could not sell to the US government, that happened this spring, has already impacted the local food pantry. Our congregation has stepped forward to try and meet that gap. We wish it was more healthy things in the food pantry, but it's in a hot little entranceway. It's accessible 24/7. It has to be something that can stay safe. We've also noted, as an interesting aside, that they are still picking up food from the food pantry, but because the variety is limited, they are receiving a lot of things that they don't utilize. So right now, we watch, and we can see people come and go on our camera system, and we know that they're making deposits of the unwanted food, which right now is a lot of black beans. So a shelf can be completely cleared out, but it's replaced with black beans that they've picked up from the food pantry. So it's kind of an interesting way. They are giving back, unfortunately, because they don't want them, and because everybody else has a large amount of black beans. They are returning a lot of black beans to us. I'm here because I'm here to tell you that it's going to fall on people and places and spaces to move forward to meet the needs. We're doing it at a manual right now, as long as we can afford to do it. But we don't have funds that are coming in to help us replace those. And so, again, as long as we can be available, we're there with food, and I hope it can continue for a long term. Thank you for your time tonight. I appreciate it.
Thank you, Michelle. Well, that's all of our presenters. We do have some questions. Someone want to grab that other microphone, Steve or somebody, and get that. So these questions are probably going to be answered by various people, so we'll pass the microphone around and get the answers for you. Thank you again for everybody coming. Thank you for everybody that helped. Rachel, Hannah, and Sheena with UW Extension. They did an awesome job organizing this. So one of the questions, first questions is about, probably for Steve. We know of a few children on the spectrum, challenged education-wise. How will their immediate future be changed, if at all?
So as I mentioned, right now, our commitment is to meet the kids' needs right now. And currently, we're not funded the way we need to be, either through the state or the federal government. And so the way that works is we take money from the general fund to meet the kids' needs, which means that every other program gets a little less. And so we've been operating, frankly, for decades. And that's our system, and that's what we're going to continue doing to make sure that our kids' needs are met. I will tell you that autism is the spectrum is huge, and the needs are very diverse amongst those students who are identified. So that is a particularly difficult nut to crack.
Yeah, you explained this at another meeting that you're legally obligated to educate these kids. You can't just say, no, we're not going to do that.
Correct. It's our obligation, our duty, and it's the right thing to do. And we've been doing it for every district in Vernon County has been doing this for decades. But it means that something else has to be reduced.
Great. Question for Trina. The $253,000 loss was for what? And what's the time frame on that?
So we applied for a grant from Wisconsin Humanities, which we were awarded for $4,000. And then we got news that the grant was gone. And this was to help fund the Ridges and Rivers Book Festival that the library supports in April of each year. Luckily, we got $700 out of the $4,000 that we were allocated. The largest loss, though, was $250,000, and that was through congressionally directed spending that was supported by Senator Tammy Baldwin. The senator had reached out asking for communities if there was any big projects that she could help support through the federal budget. And so I applied because I have been, for a long time, trying to bring a community center to the city of Iroquois because we don't have one. And Senator Baldwin latched onto that and said, I'm going to help. And my project went through every single committee that was possible to scrutinize it and cut the funding. And it made it all the way through into the federal budget until the president decided all congressionally directed spending would be eliminated from the federal budget, and that went to $250,000. And that's why I said when you say fundraising, there's no fun in fundraising, because trying to come up with the $250,000 is an immense mountain to climb. If we would have received this funding, thanks to the senator's backing, our community room project would now be under construction. Instead, I'm sitting there with a wonderful volunteer who's been helping me, scratching our heads going, how do we come up with this money? It's tough. And so that just put everything on pause until that money can be raised.
Thanks, Trina. Yeah, if I could just speak to the congressionally directed spending for a second. I was involved with that when it first came back and went away for a while. They actually killed it because there were
had been some things going wrong with it. And so they brought it back. I thought it was a great program because you could identify specific things in your district or your area that really needed specialized attention or needed to be funded that maybe would not get, and you could advocate for that within that particular agency. So it was a really great, we ended up getting $20 million, I think, the first year, and I think $30 million the second year. So congressional and Senate process is a little bit different, but the Viroqua Fire Department is another example. They got $5 million. I see Greg Wawrnick back there. Thank you, Greg. For the fire department, that probably would not have happened without that funding. So it's just a really good example. Brad, I get a question for Brad here. So the question is, what are some of the good things being done? So maybe conservation-wise, what are the things that are happening in your world that are going well?
Anybody that knows me and asks that question, sorry, you guys are done. No, there's a lot of good going on out there, and it's really, I'm really excited and proud to say so much of it is from the ground up. That wasn't even planned, but sometimes things work out. But no, it is. It just there's a lot of us in, we'll call it in the industry, in the conservation and the agriculture world that just, we know we can do better. And I always like to say it's not always about the money, but it's always about the money. You know, it's anything we do costs us dollars and cents to do it. There is, I'll give some credit again back to the state. Any of you that have heard of these farmer-led watershed groups that are really promoting conservation on the land. That is getting inspiration, I'm going to say. It's a few dollars to work, but landowners, land operators are doing good things on their land. They're building healthy soil. We're infiltrating water on top of the hill instead of running it down to the streams, running it down to the river, and sending all our nutrients and soil and topsoil and our water. That's part of what we don't realize is if we're running all that water off and it's going, no wonder our groundwater levels are going down. Our streams have less flow. They really come up to start with, but then it goes back down. We can start talking about our pollinator world right now. Just about every bite of food we take, somewhere there was a pollinator involved in that. Whether it's a fruit, a vegetable, a protein. There's a lot of good research and on-ground practices bringing back buffer strips, pollinator strips, multiple different crops we can grow to support that. There's a lot of good groundswell from the people that are working in the industry in the world right now. But soil health, water quality is another big thing. And I'm going to say nutrient management. Farmers, landowners are doing a lot better job now than they were 25 years ago. Number one, fertilizer is expensive. That's probably your biggest investment in putting a corn crop in a year. So we're looking at that better. We're keeping the soil and the nutrients on our land, and we're just doing a better job. And anybody wants to catch me afterwards, and they'll lock the doors on us.
A couple of questions that are somewhat related, so maybe you guys decide who wants to answer this, maybe Cassie. It's kind of tax levy related, so one part is about what are the odds that these funds can be replaced locally, and is it possible to do referendums on these things to replace those funding sources that you're losing?
Sure. I'll touch on the referendum question first. So as of this last year in the state of Wisconsin, we are not allowed to do advisory referendums. So that's not an option for us anymore. There is an option for a referendum to exceed our levy limit. That's the amount that we're allowed to tax. It has to be, it's very specific the way we would do it. There's a couple options if we would do it for 1 year or a continuing resolution. So that is an option should the county or one of the municipalities in Vernon County decide to go that route. As far as options for the county funding, stepping in for the feds here, not unless we start cutting elsewhere in the county. And to be frank, we do not have a lot of places to cut in the county. I wish you could see what a budget cycle looks like for us. I can tell you, I don't think there's been a year where I haven't maybe shed a tear because it's a really hard process. I can tell you with complete honesty, I'm looking at every line item in our budget every year, and there are hundreds to look where we might be able to save and to move funds around. So as much as I would like to say, yes, the county would love to step in and help fund some of these things because I think these programs are super important, we just do not have the funds to do that. We are limited by the state. So the levy limits, we get to increase that by our net new construction, which isn't much, and any shared revenue. Last year, I think our net new construction, we got to add $99,000. That doesn't even cover half of not even close to half of our salary increases for our staff. So, yeah. Mayor, do you want to add?
And so, yeah, Danny might be able to referendum. Steve, you're tired of referendums, right? So some of these folks might be able to do referendums. Others, I think the hospital could do a referendum. So maybe some opportunity there, but not for everybody. So let's see. Is EMS also funded through emergency management?
EMS, our local ambulances and first responders are not funded through emergency management. A lot of them run either by donations. I know there's some first responder groups in our county here that run based on donations. Your ambulance services are either private, Tri-State Ambulance is private, but our local ones on the eastern side of the county, those run on reimbursements per call. So they charge Medicare, Medicaid, the insurance for that patient to be able to fund themselves. They do a lot of fundraisers themselves. So they may get some federal funding under a grant, used to, but maybe not so much anymore. So those rely on donations and local support.
Thanks, Brandon. Couple of questions here kind of related to hospitals. So maybe Dave can answer these. What percentage of your budget is charity care? And is the hospital able to absorb more charity care? And then there's another one here about the effect that this will have on Obamacare. Will Obamacare be impacted?
Yeah, I think some other people have mentioned the Affordable Care Act is going to be impacted by this, and there'll be a reduction in either eligibility or the percentage of programs that will be covered. Again, can't even begin to tell you the specifics of what that would impact, because I think some of that is still yet unknown with that. Charity care, percentage-wise, I cannot place what that percentage is, and so we provide care to everybody that comes through our door. We're not allowed to, nor similar to the schools, do we want to turn anybody away. So someone presents to our emergency room or urgent care, we provide medical care to them. We're legally obligated to, but I would also say we're mission obligated to provide care to those individuals with that. And so, we take very purely the responsibility to have, emergency services and behavioral health services and obstetrical services and lots of things that are not reimbursed. They do not cover the cost of those individuals. We're an employer of over 510 people in the community, and so we're one of the largest employers. And so, again, that responsibility to be hopefully an economic engine to the community, but also provide the key services that a community needs. Funny story, I'm in a business during the winter, and an ice storm is coming in, and the person at the business that I won't mention said, "Ice storm, I bet you're really excited about that. The emergency room's really going to be packed." And it was kind of like, we don't hope for bad things to happen in the community. I hope our community doesn't think that that's what we are. We hope it's a very healthy community and people are doing well and people are staying home in an ice storm. what we hope is that if you're not well and you need care, that you would choose to come to us for that, because we would have the services and the quality of people and the quality of things that you would want. It's an okay day if you're all staying home and being healthy. That would be okay. So please, feel free to do that. But if you do need care and services, again, we're going to provide that for you, regardless of your ability to pay. And I think that, again, what's going to happen with the change in Medicaid is going to impact individuals' ability to pay, and we will still provide care to them because that's the right thing to do in our community. Does that answer the questions?
I think so.
Okay, good.
Thank you. Dave. We have another one about the green energy credits and solar, so I don't know if anybody here can speak to that. I see Al Buss out here, maybe he can speak to that. So do you have any information on what's happening with credits?
Sure, a little bit.
I'm waiting for him to nod like he will take the microphone. All right.
This is Al, he's with the Vernon County Energy District.
Energy District. So with the passing of the recent bill, the tax credits for any energy upgrades, EV purchases, solar installations, battery backup installations, heat pump water heaters, those have all been removed either by the end of the year. The EV credits will all be gone September 30th. So there's still a little time. If you want to take advantage of them, you should jump, but they're going to go away. That's the difficult part. The positive side is the energy rebates, the IRA rebates that luckily Wisconsin has. Many states in the nation do not yet, but luckily we have those in Wisconsin. Those remain intact. I've not heard any other ways that they would be going away. It's not out of the realm of possibility, but at least they are here. So you can still apply through Focus on Energy and get the process started to get those rebates as well.
Hetty, do you want to add to that? Hetty's Coulee Cap does allow with solar.
Yeah, and yes. And also, if you happen to be part of a nonprofit, including a church or other nonprofit, the direct pay or electric pay incentives are still available. So nonprofits can still install solar on your buildings and still be qualified for the direct pay or electric pay incentive. Those are not going away.
We got one more here about education, and we're going to ask maybe a general question to wrap it up. But Steve, what is the impact of vouchers on your district?
Again, this varies from district to district. The amount that we have, so the tricky part is like we pay that money out, but we have to make up for it, so we wind up taxing for it to get it back. And so it's a total misnomer that there's no free money out there. So what happens is, over the past 3 years, like the amount that we've been contributing to the voucher program has about tripled. And the same is true in Viroqua, and that is a really, really shocking number. So I would just encourage you, if you are connected to that community, that school district, to take a look at it and give a call to Jeremy Hill and ask him about the impact of vouchers. The simplest way I can describe it is this. We don't have enough money in the state of Wisconsin to fund public schools. So what on God's green earth would say that we have enough money to fund two systems? And that's kind of what the voucher system is about. So it's a fragmenting an already small pot of money, and it makes it incredibly difficult in public school.
One more health-related question. Somebody asked a question about, they've heard that rural hospitals are in danger of closing because of loss. I think you're on the Rural Hospital Association or whatever that is. Is there any, I think we've had 2 hospitals that have closed in Eau Claire previously. Is there any possibility that rural hospitals could close?
Is there the possibility that rural hospitals will close? Yes. Is Vernon Health closing? No. So I sent an email out to our entire organization last Friday, trying to make people be at ease. I was kind of waiting for about 2 weeks to learn whatever I could that after July 4th, so that I wasn't making any mistakes in what I was saying. And basically what I tried to send a message to our 500 employees was, there's a lot of stuff about healthcare out there. This is about what we understand right now. Vernon Health is in a strong financial position because of decisions made over the last 20 years before I got here. And after we've been here, we've had a good board, we've had a good medical staff, we've made good decisions to try to weather that storm. And again, try to reinvest where we can in services that will serve this community. The Medicaid change will adversely impact us. As you talk about the rural transitional grants that are out there, and again, $50 billion sounds like a big number over 5 years. I have no idea if 11 cents will come to Vernon Health or more than 11 cents will come to Vernon Health. If more than 11 cents come, we can do good things to take care of our people and our patients and our buildings and all of the things that you want us to do. We've had a huge project out in our parking lot. My apologies for how long that has taken, but that's electricity infrastructure. When you're having a surgery, your surgeon would really like it to be kind of cool and not have the scope fog up when they're in the middle of a surgery. You're going to be asleep, you're not going to care about that, but you really do care about it when you wake up that everything went the way you wanted it to. And the lights to come on, and the generator to happen if the electricity in the county keeps to happen. So we need to continue to do that, much like every business is invest in having the infrastructure of the things that you kind of need. And so some of the monies sound like they might be able to help with some of those things. We've replaced all of the lights in the organization. We've gone away from steam, so we're trying to be more eco-friendly as an organization also where we can with that. So take home, please. Vernon Health is doing okay. We'll continue to do okay or better with that. And again, try to invest in that. We have 2 new behavioral health people joining us in the fall. So continue to invest in that need, knowing that that's a need in our community. And continue to try to recruit physicians. You've got people like Deborah Pryor, who's going to be retiring at the end of the year. We're sad about that. But we've got some new recruits that are trying to come in and trying to, again, spend appropriate money making sure that people feel like this is a place that they want to live. Thank you to the community for having a great community that physicians and nurses and techs want to come here because they see a great school system that's in the area and they see a great library and they love the co-op and all of those kinds of things. Thank you to the community. It helps us to be able to recruit those things. So, thank you.
Thank you, David. A couple of things to clarify. Some people asked some questions. So how can this information tonight be gathered up and then redistributed? So we are recording. I'll try and post that recording to my YouTube channel and get that out as far as we can. So that's the best way we can consolidate this, I think. And then I just want to ask a general question of everybody, which is, and some people were asking generally about this, but what can you tell people who are here tonight about what can they do when they leave here? What would you suggest that they do? Or what kind of actions can they take to help alleviate some of this? Anybody? That's a pretty broad question. Michelle?
I would say on my end, help support the local food pantries. And food is great, but what you might be thinking is what the community needs may not reflect what the community uses, and thus I get lots of cans of black beans. So if you give food pantries money, most of them can utilize that money through community harvest solutions or other things. So to buy a gallon of milk, it's $2. For them, you're going to pay a lot more than that. Your $5 can buy 2 gallons of milk. So that's an important consideration. We are happy to accept money on food at Emmanuel for our little food pantry because it's needed. I don't have the ability to go to Community Hunger Solutions, so we are paying the $5 for things, but it's all going out to help people who are really in crisis. We had someone come in, and unbeknownst to them, we overheard their conversation. They didn't realize one of the windows was open. And they were saying, oh good, I get to eat tonight. That happened at 7 o'clock on Saturday night.
Anybody? Danny?
I guess my plan would be that you all go out and talk to your friends and neighbors and stuff like that. Hopefully you learned something here that you didn't know, where funding, federal funding is important. I think the point was to make everyone aware of where the funding goes and what it's utilized for. And so when it does come up with a topic that something's going to be cut, you'll realize how important that may be. You know, we're not here to get into a political thing or anything like that, but, you know, I'm tickled to death to see about 100 people here. And if everybody would talk to their friends and neighbors and let them know what you heard and that this was just to kind of fill you in that, you know, you hear these numbers, federal funding for this, grants for this, and everything this is how it gets used, and how important it is, so we don't want to lose it. Like I said, there's not saying there's different ways to spend things and accomplish different things, but I guess if anything, talk to your neighbors and friends and get a conversation going on. So that's all I got.
Well, that's exactly what I was going to say. That's the best way to get this information out is to educate yourselves and then talk to your neighbors, talk to your friends. Call your politicians. We're not, you know, you don't need to be political, but you need to, politicians don't necessarily know how all these programs work and how they really affect people. So getting the word out is what's really going to make the difference from the grassroots level and going on up. So, some suggestions.
100% contact your elected officials. You may not know who your county board members are. Their contact information is on our website. Pay attention to what's going on. We post all of our agendas. We've started recording all of our meetings, so you can go back and watch it. You can sign up to get notices when we publish our agendas, so you can see what the county board is going to be talking about. But that staying informed piece is really important. Yeah? No? Okay.
Just a quick one, just support local. Support everybody here, support whoever's around you, and do that, whether it's, you know, conservation organizations, whether it's your local libraries, your local nonprofits, your local farmers, your local retailers. We got to help each other out. We're all in this together.
Anybody else? All right, we better wrap it up or I'll be singing A Spoonful of Sugar. Which might be a good song at the same time.
I have one thing to add, what you can do.
Go ahead.
So there's been a lot of attention given to the bill that's already passed, the tax and spending bill that affected Medicaid and Social Security as well. But there's a legislation that's being considered that's really important that is actually funds everything we talked about tonight because it funds discretionary funding and all the grants and programs. That's still being debated right now in Washington, D.C. Those appropriation discussions are happening in July and August and will be decided on in September and October. So while one bill is passed, all of the funding that funds us, that funds a lot of the programs, that's all still being decided. So if you heard something tonight that moved you, it is now time to make those phone calls. Write letters to the editor. That would be great if you could write letters to the editor about something that you care about, that you heard tonight, because elected officials will read that, and those are decisions that you can still impact, because those decisions have to be made before October 1st for the next budget year. Those decisions are still active, so thank you.
Thank you, everybody. Great turnout. Oh, sorry.
One more thing. So for the last month, the 478 public libraries in Wisconsin have been running a campaign called Speak Up for Your Libraries. And it's been unbelievable. We've just had postcards at the Viroqua Library, and people have just come in and just wrote down what a public library means to them, and these are all being sent out to our elected officials. We even had someone come in and say, here's $20 to cover the postage, because our libraries mean so much. So it's never too late to speak up. Reach out to your elected officials. I've had many conversations with Tara Johnson, with Brad Paff, with Senator Baldwin's staff, and they listen. They really do listen. It makes a difference. Be a voice.
Thanks, everybody. Now you see why breakfast at Bargains is always fun and exciting. Goodbye.